State Governor Jay Inslee has issued a new 14-day quarantine requirement for anyone traveling into the state.
This affects travelers coming from the UK, South Africa, and other countries where a new variant of the coronavirus has been circulating. Joining us to talk about the new variant is Dr. Krager, Clark County's public health officer. Good morning. Thank you for joining us.
Good morning. Thanks for having me.
Yeah, so Dr. Krager, is this new quarantine advisory just being really cautious and trying to get ahead of this here? Or have there been any cases of this new COVID-19 mutation detected in Washington?
It's being cautious. We have not detected any of this new kind of mutated strain of the virus in Washington. So we're being extra cautious. At the same time, it's possible that it's already here. I think Dr. Fauci was talking about how it's possible that it's already in the US. That means it's also possible that it's been in Washington. But anything we can do to kind of slow the spread of this new variant, I think will be helpful, which is why that new quarantine is in place.
What do we know about the differences between this variant and the COVID-19 that we've been talking about for most of the year?
Yeah, it's mostly the same. Viruses mutate a lot, kind of all the time. We know that with the flu virus, which is why we get, a new flu vaccine every season. And we're still learning about this new variant. The fear is that it spreads a little bit more quickly than the previous variant of COVID-19. We don't think that it causes more severe disease, but we're concerned that it spreads a little bit more quickly between people, which is what they've been seeing in England.
Yeah, with health officials warning overseas that they do believe this could be more contagious. Of course, that comes at this time of year that we've been warned about for several months. We've all been looking ahead to this winter and anticipating going into really the toughest stretch of this pandemic. So I'm curious, do you think we could be seeing more local and national shutdowns here in the U.S. as we begin 2021?
That's really hard to speculate. My hope is that we've done a good job, I think, especially locally, of protecting our healthcare systems. Maintaining our distance between people, wearing masks. Compared to other parts of the country, we're doing a pretty good job. It's hard to say what this new variant is going to do. Hopefully it hasn't come here yet. We're obviously watching very closely, and we're going to continue to watch very closely. I think we need to focus on kind of the things that we can do, wearing masks, avoiding large groups of people, and getting vaccinated as soon as possible. Obviously, it's not available to the general population, but we're hopeful that soon more and more people will be able to get vaccinated.
From what you've seen, will the vaccines that we have out right now work against this new strain?
Yeah, that is something that is being looked at very closely. The kind of preliminary analysis is that yes, the COVID-19 vaccines that we have will work against this new strain. We need to kind of look at that in the real world a little bit, but that's our understanding right now, is that the COVID-19 vaccine is going to be effective against this new strain.
So at the risk of drawing too big of a parallel here from COVID and flu, when we look at influenza, we have to get a flu shot every year because that virus mutates so quickly. Do you see that potential here with coronavirus? How quickly could we see another mutation down the line?
It is certainly possible. This virus has only been around a year, so we're still learning about it. We still don't know exactly how it's going to behave as time goes on, as it infects more people. So it's gonna take some study. It also just depends, how long our immunity lasts if we get infected with COVID-19, how long our immunity lasts when we get the COVID-19 vaccine. Those are all things this just hasn't been around long enough for us to know those things with confidence. So it's certainly possible that yes, we may need, booster shots or a different shot every year for COVID-19, but it's too early to say.
Yeah, lots of things still up in the air here, but of course what remains is the best practices that we already know we need to be sticking with. Dr. Krager, thank you so much for joining us. Merry Christmas. Happy holidays.
Merry Christmas. Thank you.